graduated high school, I wanted to be a physician.
I have a medical student, Joe Stoke, with me today.
But I really didn't know much about osteopathy.
So where's your pain level at now as opposed to when you first
I had been on a track towards medical school. I had occasion, suffering from a sinus infection, to visit a physician.
So she's a little restricted on the left.
During the course of that, he did an osteopathic manipulation, which when I walked in, I couldn't breathe. I had pain in my face. I walked out pain-free and could breathe again. I recall saying to myself, I want to learn that so that I can offer that to my patients.
I chose osteopathic medicine versus allopathic medicine because of the holistic approach to medicine.
We have all the same courses. I don't see us as deficient in anything. We actually have more that we do.
I think that it really gives you an edge with our clinic here in terms of preparing you for family practice.
When it came to choices for residencies, it was pretty easy for me to make that decision, and I didn't really even look anywhere else.
What brings you to the doctor? Well, I think there's a real lack of good family practice physicians, and I think Trinity at Terrace Park has taken a step to try to fill that need.
The internship program that I was in didn't offer hospital medicine as an option. Here at Trinity, we have the ability to do that from admission to discharge.
Well, Trinity Terrace Park is a state-of-the-art facility. The residents get to see the patients both in the hospital and then follow them up in the clinic.
You get to know the patients very well here. The patients are truly your patients.
I'm just going to look in here.
I do. I get all age ranges. We see the newborns. I've seen 90-year-olds who are doing really well.
We have a lot of services that are available. Our residents here will learn a lot of procedures, and we're able to kind of tailor their interest.
If you were to want to get more opportunities as far as OB and deliveries, you can make that happen even when you're not on your OB rotation.
This program offers us the opportunity to have unopposed training.
So truly, any specialist who has this procedure and is willing to have someone watch or participate in it, you know, they come to us first.
One of our residents is very interested in hyperbaric medicine and wound care.
With the hyperbarics, no, this is a subspecialized piece of equipment at some places.
How are yours doing?
I'm doing okay.
Family practitioners don't even have a chance to do this. It gives you an opportunity to get a taste of what it's like.
We also have an outstanding record with our emergency room, and the residents play a vital role in keeping that outstanding record going.
One of our peripheral cardiologists was the first person in the country to do what's called a turbo peripheral procedure. It involves lasers used to open up the arteries in the leg. First in the country to do it here at Trinity Terrace Park. The Trinity West Campus is getting the Da Vinci robotic surgical system, and our urology group and some of our general surgeons are going to be trained to do robotic surgery.
Very exciting to be kind of on the cutting edge of robotic surgery at one of our facilities.
I want them all to see this and to experience it.
We did get the echo result back. Our freestanding residency clinic has switched to electronic medical record.
It's been a challenge to adjust to. It's really improved our patient care.
Well, when I have a resident with me, I want him to learn how to treat patients. I have them go into the room and evaluate the patient and then come out and present to me, and then we go back in together and go over things to make sure what they're doing is accurate.
We feel we have autonomy to treat the patients as we see fit within reason.
I love the Quad Cities. It's big enough you can find about anything that you want. It's small enough that you still get the small town feel.
There's very minimal traffic here in the Quad Cities, and there's a wonderful system of bridges that connects Iowa to Illinois, actually, so we have the opportunity to work in both states.
The low cost of living here allowed me to buy my own home for the first time.
It offers a lot of great family opportunities. I think there's a lot to offer here in the Quad Cities, and I wouldn't have returned if I didn't think so. That's a great incentive to have your meals free here.
The meals are good. Breakfast, my favorite meal as well. They have a good variety. This allows me to afford a little nicer apartment. It really does.
I guess the difference in this program, we're very close. We all work very well together.
I've been very pleasantly surprised by how supportive the entire hospital community has been of this residency program.
Well, they go out of their way to make us feel welcome right from day one. You know, we have the resources, we have the credentialing for all of our specialists. You'll get excellent training. Definitely come and give us a look.
I'm sure that in 5 years from now, this program will be the best family practice training program in the Midwest.
I'm Andrea Coleman, President and CEO of Trinity Regional Health System. Since we began our program, Trinity Regional Health System has trained nearly 200 medical students and residents who are now practicing here in the Quad Cities and all over the country. Trinity's commitment to excellence is reflected in our faculty, our facilities, and our culture. Our students and residents have access to a broad range of programs at Trinity's 3 hospitals, some normally found only in major institutions. Trinity's collaborative learning environment is a great one to prepare the physicians of tomorrow, and that's you, for success. All in a beautiful community that welcomes you. See for yourself what we're all about. Trinity is a better learning experience.